This bill was essentially written by staff in the Finance Committee who had previously worked for places like WellPoint and United Healthcare. This is an insurance company's dream. I understand the White House is upset with my criticisms, and I understand that. That's an argument in the family. I hope we can all be civil about it.
But they're not being civil, though. I mean, and you got Ruth Marcus. She's such a nice, reasonable lady. We love Ruth. She says you're losing your mind. You're going crazy. You need to be institutionalized, put in a straitjacket.
Well, people who talk like that generally don't have much impact on the debate, first of all. And second of all,
we're talking about her. It's a great headline.
It's a great headline. Those are also the same people that said I didn't know what I was talking about when I said we shouldn't get into Iraq, when our party caved in on that issue 6 years ago. So, look, the fact of the matter is I wish this bill were a better bill because I think we need health insurance for all Americans. I'm still a huge supporter of the president and a huge supporter of all those senators who are upset with me. But the fact is, this has now become an insurance company's bill. With the loss of the public option, the loss of Medicare, this bill really does more harm than good. This is not a personal battle between me and Senator Rockefeller or the White House or Joe Lieberman.
Well, they're making it personal.
Yeah, well, that's their problem.
I mean, when they say that you're taking your football and going home, they're making you sound like a petulant 5-year-old or me.
Look, here's what happens, Joe, and you all know this from watching Washington. In the last couple of weeks, and I've seen this in every legislature, this happens, they get so invested in this bill, what they want is just anything to bring a bill home. And at the end of the day, they craft the bill in order to get votes instead of in order to do the right policy. And there's a line, and if you go over the line, you're going to do more harm than good just to get a bill, and that's where we are today. I happen to know a lot about this. This is my life's work. Yeah. If you pass this bill, this is so typical of Washington, and you're onto this. In the last week, anybody will do anything to get this bill out. The problem is this business about let's get this vote and just get to the next body. This bill sets the tone for what happens in health insurance reform for the rest of the history of the country.
All right,
and if you start making concessions and just to get votes from people who really don't have the best interests of ordinary people at heart, i.e. who care about the insurance companies, then you put this country on a trajectory which is a disaster. And that, in my view, despite the good things in this bill, is what the Senate does. When I get criticized by my own friends in the Senate, it's not because they think I'm going to take my football and go home. They know me better than that. It's because they are absorbed into a process where the only goal is to get this bill passed.
Yeah.
The problem is, in that short-term thinking, they've lost sight of what's going to happen when this bill goes out. I know what's going to happen when this bill goes out because I've been doing this for 15 years ago. We did what they're trying to do now. And you can't, if you make a small mistake and give the insurance companies the upper hand, and this bill gives the insurance companies the upper hand by simply getting rid of good state regulation. That's what it does.
I got to tell you.